city to institute a board of health, but I think we were the second. And we have the oldest, continuously existing health department. So the New York City has been central in the concept of the health of the public being important to how the city works. So that always gives me some hope that there's an awareness in New York that when something changes, that we have to ask, does it make people healthier or less healthy? Does it hold some people back? I mean, I think that here we fall down on the job often at drawing the distinctions that Rabbi Katz was asking about, the big people and the little people. But many New Yorkers at least try and there's always a sort of strain of striving for justice. So that gives me some hope. Specific initiatives, New York City fell down on the job with coronavirus. It has recovered, but we really didn't get going until June, when the worst had already passed with a proper public health response. New York City has not kept up funding for public health endeavors, or has put a lot of funding into educating people about diet, things like that, which are important, but don't get at some of the fundamentals that we were talking about here. Crowding, being able to afford decent food. It's nice to tell people what they should eat, but it only works if they have enough income to pay for it. So I still feel there's a lot of work to do.
Great, thank you so much. We have a couple of questions that are focused on kind of what are practical things that people can do. We have a question from Miriam to Reverend Cabrera about what are some concrete ways that we as a community can be supportive. And then also a question from Susan Schwartz about this idea of purchasing fresh fruits and vegetables and healthy food. And are there specific initiatives that y'all are aware of that we can support specifically around that? So Reverend Cabrera, why don't you start first, kind of in general, are there any specific things that you think our communities can be doing? And then maybe if you have ideas about this healthy foods initiative, if there are anything specific there.
You know, in a breakout room at the very, very end, I believe it was Diana was mentioning education. I think education is key. And I had it in my notes here and I failed to bring it up. We got to start working with our young people. We got to help them to create patterns of healthy eating. I passed a resolution that actually turned into action policy. It's called Ban the Bologna. And basically, we don't have bologna and processed types of meats not being given to our kids. The research is clear as to what it does to our bodies. And we have Meatless Mondays. I think that we need to go back to education, educating our kids, lending our expertise. Every congregation have healthcare workers that really get it, really understand, nutritionists, and lending those out and volunteering those expertise where it's needed. So it becomes, and here's the key, I think, it becomes part of the culture. And that's my dream for the Bronx. My dream for the Bronx is that we have a culture of healthy eating when we value health, and we actually have those concrete steps that will get us there, and the government backing that up, faith-based communities backing that up, community centers disseminating that type of health.
Great. Thank you so much. I just want to throw out another couple of questions, and then we'll go back to Dr. Covers. We'll kind of bounce back and forth, and I'll just throw out all the questions so that folks can hear them and you can address them as they come. So we have a question about what is a possible way to address the PTSD, the post-traumatic stress, and the despair that we were talking about before. What are some ways that the system might start to try to address that? We have a question about skepticism toward the medical community. What does it mean when the culture of communities is not to inherently trust the medical system or other folks? And then we have one other question about barriers to access. That what does it mean when some people are able to get time off from work to go to a doctor or other things, and how does that prevent people? So if you'd like to touch on any of those, we'll go to you, Dr. Alcabez, and then back to you.
I would actually like to hear what Reverend Cabrera's experience is about PTSD in the community, because I've recently become interested in this. Basically, I learned about this from a student. Since you're working on gun initiatives, Reverend Cabrera, maybe you'll meet her. She's just got a job working on public health issues, including gun violence for NYCHA. Her name is Carrie Torres, just in case she comes along. So Carrie was a graduate student of mine like a year ago, was very interested in PTSD, post-traumatic stress disorder, is very well known in America as a problem for veterans who have seen combat. And I think lots of people are aware of that, but it turns out that if all, it looks from existing research, recent research, that if all PTSD were properly diagnosed, the great majority of it would be occurring among civilians who have never seen either police duty or military combat. And much of it comes from witnessing violence or living in neighborhoods where violence seems like a possibility. And PTSD can be a kind of gnawing away at a community because it's so hard to diagnose, hard to treat, and lots of people with PTSD can diminish the essentially the community bonds. So I wonder what Reverend Cabrera is seeing with PTSD, and if that entered into what you said, Reverend, about despair.
You know, and I appreciate that, Doctor. One of the opportunities I had throughout the years is to be in critical incident events. I was in 9/11, in Ground Zero, Haiti, where over 250,000 people die. Also people literally dead, left in the streets. In Puerto Rico, Hurricane Katrina, and on and on. And what I learned from the people in the field and those of us who were working, that one of the critical things is to work with people early on, that we provide people an opportunity to debrief. Let me just share a 30-second story. When Flight 587 went down, American Airlines, right after 9/11, a month later, I remember being there 12 hours working with the families. And I remember I got into my car. My wife came and picked me up because they have high security there. And my wife asked me, how did it go? As soon as she said that, and I started to answer her, I just began to cry uncontrollably. I shared that with my team the next day. And somebody wisely said, hey, we forgot to do something. I said, what was that? We forgot to debrief. We almost need to do that for the public at large. And this is where a key question that just came on, that was asked by Marion here, was somebody in the audience, which is, what do we do with people who have no trust in the professional? And I think this is where a faith-based community comes in. The synagogues, the houses of worship, the churches. One of the things that we did in our church, and I have to tell you, it was the saving grace, was our small groups. We were meeting in small groups. We have about 30 of them. And we had an opportunity for people to share what they were going through. And so many of them have said, that was the place where I got to cast all my cares, my anxiety, my fears. I got to understand I was not alone. I wasn't going crazy thinking about the thoughts that I was thinking, the loneliness piece with all this social distancing. And we're so much into being interconnected, and we need to be interdependent with one another. I think that's what we need. We have a critical role, and this is why I'm so happy that we have 3 houses of worship here talking about this. And I think the small groups, being able to establish that, and we could do it over Zoom, and have an opportunity for people to be able to share with one another. And second of all, we need to help people who are helping people. We need to help the helpers. We see school counselors. I'm a certified school counselor. I did it for many years. I have to tell you, so many of us have gone through so much, but there's nobody to talk to. And I talked to the UFT about this, President Moore Group, and I said, we need to get help for the helpers.
Thank you. So, yeah, go ahead.
So coronavirus has really brought that problem out. And many of the hospitals have imported counseling for physicians, nurses, other staff, but it seems, at least from the reports I've heard, that could never be adequate. That the degree of psychic, emotional trauma that people who worked in hospitals was going through was just, unremediable. Even if there were enough counselors to talk to everybody, and even if people had time. And it's likely that this is going to get to be more of a problem. Coronavirus someday will be under control, somehow or other. But there are always going to be health problems. And if society continues to become as fragmented and socially isolating as it has been in the last 25, as it has been becoming in the last 25 years, then the people who are supposed to be serving others are going to themselves need to be served.
Thank you. Rabbi Katz, you wanted to add something.
Yeah, I just want to respond to something that Reverend Cabrera talked about. So years ago, many, many years ago, Reverend Cabrera and I were having lunch together, and he told me about these small groups that he had in his church. And I thought it was a fascinating idea. And I thought, oh, but that would never work in a synagogue. Like, it would just, I had a million reasons why I didn't think it would work. But Reverend Cabrera, unbeknownst to you, when all this started, the first thing that we did, inspired by you, I've had that envision in my mind, like, that would be so amazing. I can't do that, is we set up small groups. We call them emunah groups. That mean faith or steadfast. They were heterogeneous groups from people who didn't necessarily know each other in the synagogue. And it was a place where people can go and support. And the only rule about it is you have to check in with each other once a week. That's the only rule. And it was inspired by you. And I didn't have a chance to tell you, but like hearing you say that just reminded me of like how much we need to learn from each other, right? That you taught us that thing that became, for many people in our synagogue, like this incredibly powerful link to the world. One woman said, the whole world is shrinking and my world is expanding because I'm meeting all these new people. And so just as a plug, anyone from our synagogue who wants to be part of an emunah group, you're welcome. Anyone on the call who's not part of our synagogue, we would love for you to be part of one of our groups. So send me an email and I will get you in one of the groups. Thank you. Thank you, Reverend Cabrera.
And Rabbi Katz, I have to give the credit to our Jewish friends, because we learned that from Moses. Moses divided them into small groups. His father-in-law said, "Hey, you're gonna go nuts if you think you could do this all by yourself." So thank you. And can I just add one more thing? Houses of worship. We're the only ones that could answer some existential questions that people having right now. That not even psychology could answer right now, because it is dealing at another level. And so as much as I love the mental health field, and so I think we play an essential role to be able to help people deal with this, conflicts that we have in our spiritual life.
So I just want to say thank you on that note of learning from each other. And I know I've done a lot of learning tonight, and I just want to deeply, deeply, deeply thank Reverend Cabrera, Dr. Alcabez, Rabbi Katz for your framing Dvar Torah at the beginning. This has been a really amazing night, and I really want to thank all of you for being here and for hearing sometimes difficult things and for being a part of smaller group conversations within our bigger group. And for bringing your whole selves and for bringing your honesty and your experience, and that the way that we're going to move forward together as a community is by deepening these relationships and having these honest conversations and figuring out what we can do to move our community forward. And as Miriam just pointed out again in the chat, next week, we'll be dealing with what I think is such an incredibly important conversation about how to talk to our children about race and racism and anti-racism work. So we really encourage you to join us at 9 p.m. for that. And thank you all again so much for being here. And we hope to see you next week. And everyone includes everyone from New Life and from Creston Avenue Baptist Church. We know that this is not just a Jewish issue or a white issue or a Black issue or a Latino issue, but we're really glad to be talking about this all together.
I also, and I want to thank Ben, our rabbinic intern, Rabbi Greenberg, who couldn't be here tonight, just taking some well-deserved time off, Miriam Westheimer and Meryl Nadel, who are helping kind of vision this whole process and organize each of the sessions. Thank you very much.
Bye, everyone. Have a good night.
Bye.
Good night.
Good
Thank
night.
you again.
Thank you.
Bye, Reverend. It's been a pleasure. Bye, everybody.
Bye-bye, everybody. Fantastic. Thank you for the opportunity.
Bye, Reverend.
Bye. Thank you.
God bless you, my friend.
Sending love. Bye.
Likewise.